Hello, everyone. Welcome to the J3U podcast. I'm your host, John Jewett. With me is co-host Luke Miller. And today we're talking the holding phase, maintaining. I know it doesn't sound sexy. Please hang in. It's going to be much better. We could call it gaintaining, cementing the gains, however, whatever you want to make it like sound sexier, right?
What's the clickbait title we can get to make them listen to this podcast? Oh,
but no, today, like there should be some phases between when you're pushing up off season, contest prep, fat loss phases, mini cut phases. There has to be some transition points in there between each phase. And there's a rationale to doing so and why they should be happening. And I will say too, like if you're not planning these to happen, sometimes they'll just happen and it's not by your choice. And so that's what we're going to dive into really discuss today of why these should be in place, how to implement them, and what are the variables around them that we would be manipulating during this phase.
Yeah, so I think the first one is kind of like diving into where the purpose of this phase could kind of hold credence. And a lot of times we often discuss this from the context of like off season into contest prep, or even in the confines of off season to a mini cut. And the first purpose that like comes to my head is going to be a rinsing of fatigue, a management of health metrics and variables, and making sure that we're getting those back in check. So once we start to kind of go down that thought process and that logic, a lot of times we're seeing this phase be pulled down in PEDs. We're probably around baseline PED metrics, making sure that we're managing some of the health metrics that we can. Oftentimes we'll see the weight kind of just drop off from the disclusion of PEDs, right? Because we have less influence on RAAS. And we'll kind of see that water shift, just kind of drop some weight. Like to give an example, like I'm kind of in this phase-ish right now, like in my off season between pushes. And like I dropped from 253 at the peak to like holding 245 right now. About a 7 or 8 pound drop, which is fairly common. And I think that this is kind of the start point of where a lot of these phases kind of start. Yeah.
Yeah, no, I agree. You have to look at, what really brings your off season to an end when you actually need to make a transition. So
yeah,
like for Luke, you had your own scenario there, but for a lot of people, when you're pushing body weight up in an off season, gear's progressing, food's progressing, training's progressing. Out of all those three, there's going to be some type of stop point that's going to occur. With food, it could be appetite tanks, no more hunger signaling. You feel like you're force feeding food down. Regarding training, there's just this constant accumulation of training fatigue that will occur connective tissue wise. So you could have niggles and things that are just cropping up that just have to be addressed longer term with PED usage. That progression in place, as the more advanced you get, you're going to get to levels that are unsustainable. And you won't be able to stay at this gear level. Why do you guys you have to back down your cycle at some point, right? And this is usually health marker derangement to some extent, whether it's, blood glucose is getting elevated, blood pressure is getting elevated, some type of lipid disarrangement that's occurring. And so those are some aspects. Then there's also a body fat is just at a point that is no longer pushing up. And it's not that, I do believe that there is a level of like insulin sensitivity that you should maintain to stay really optimal, and for a lot of reasons for training performance. And I think partitioning makes a difference, but at some point you're going to have a further partition to body fat gain once body fat gets higher, and you got to diet back down for a show too. So that's something to keep in mind, at least for us in the bodybuilding physique world, is that when you're 20% body fat and you need to get down to 3%, this might be a 30-week prep, and that's just not ideal. So it's needing to bring that body fat back down. So these are kind of like a few variables that might end the push phase. And what would you do to restore these levels? And a lot of times it's going into what we're calling this holding phase, which potentially it could help with, even some people say, solidifying the tissue that you made. What are your thoughts on that? You hear people talk about cementing the gains.
Yeah.
Does it have any credence to this, or?
I think the cementing part is the training performance, in my opinion. I think if we hit a certain level within training performance, that needs to be able to be maintained throughout, or even slightly progressed throughout this holding phase. I think commonly you'll see a slight reduction in food heading into this phase, in my opinion, just out of the thought process of PEDs coming down and wanting to improve a lot of these metrics. And just as a thought point too here, like if body fat creeping up is one of the reasons that we're seeing this phase ending, we're commonly often seeing like more issues managing estradiol, rising estradiol causing more issues managing blood pressure. And so now it's like you just tipped this big fucking domino that's causing all of these effects to kind of downstream happen, that's making troubles for us. So within this holding phase, we need to be able to fix that. And for a lot of people, a slight reduction in weight and a slight reduction in body fat is going to be needed. So we will see that food pull down a bit. But when we talk about maintaining what we've gained, the deficit that you create shouldn't be like the deficit you're wanting to do when you do a contest prep, right? It should be just enough to kind of bring them down a couple pounds, in my opinion. And then the maintenance phase is more about maintaining training performance and seeing that continue to progress and what that may look like. And I guess the question oftentimes I get is like, should training change here from a volume perspective because of the lower recovery capacity?
Yeah. Yeah, within that. So that initial transition, with it, you still are training, like for a lot of us, how we do it, it's kind of it's always auto regulated.
Yeah.
Just the main framework of our training is still the same, keeping a quality of set of high effort close at or near a failure point, and same movement patterns that we would be selecting. Those still all make sense for that intention of training. But really the main things here is just volume manipulations. So this might be, it's like, if you do notice, like, hey, since you are bringing down PEDs, you be maybe adding in a rest day or just bringing down total training volume in a session. Maybe you've been running some type of specialization block, like really slamming like back 3 days a week or something. So maybe you're going to move to more like a moderate split that's just across evenly for multiple body parts. Usually this is also when I would move someone from just doing, like, if they had any type of rest pause or drop sets, just moving in just to like straight sets to help manage some fatigue. But really across everything, like load rep progressions, how we implement, that's all the same.
Yep, 100%. What's your opinion on the maintenance phases then?
Like as far as like the
cementing part.
Oh, the cementing part. Yeah. I know it's like, is there a delayed, well, I guess that's the part of the question, right? Is there delayed growth that happens? And I mean, maybe you would recall better than me. I was just talking about this earlier. I did another podcast earlier, trying to remember the study. It was the blood flow restriction study where they're like untrained individuals, they like fucking killed them on BFR for like 2 weeks. Then 2 weeks after, they actually saw a muscle size increase, but they actually like decreased, I think, tissue growth during, like showed like atrophy, but swelling. Then like swelling dissipated and they actually were able to recover and add some tissue. Do you recall that study?
I don't. I'm not the author.
I'm making it up. No, I'm not. Yeah, but basically it's like not untrained subjects. It's not very applicable. So but then there is like some of the research from like Cody Hahn, looking at the process of hypertrophy, that there's like this sarcoplasmic growth that happens, and then from there it's tissue accrual. So there's increase in ribosomes and all the substrates needed to then lay down tissue. So it's kind of like this process that happens. So if you're coming off a block that was accumulating a lot of fatigue, could there be some extra growth that happens in those weeks following? Hard to say. I don't think we have enough to really say that there is.
Yeah, I think anecdotally, what you'll see is just like, if we keep the focus around training performance, we'll see whatever it is that you maintain or created during that push up will be maintained, right? And another thing too, maybe the thought process of not diving into a large deficit straight out the gate, right? Because this is where we're going to start getting into duration, right? Is where, what does the time scale look like when we get into this phase of like then going into a deficit where we'll actually see that adaptation start to occur at a rate that we want to run a prep, or we want to run a mini cut, or that kind of a thing. I think that's a lot of where the value is. And so like from a training perspective, I would lean towards what you said, like extra rest days, slight lower in volume, slight reduction in nutrition because the PEDs are coming out, but not a large one. So very small percentage.
Yeah, like because someone's been in a surplus, even slashing 500 calories out could still bring them. They might still be in a slight surplus, if not maintenance, but the load on the system is a lot different for bringing down blood glucose, improving health markers, and how much insulin that person would be putting out. Yes, as far as like delayed growth, I don't quite buy into it. Or there's in the other argument of like a settling point that you should be, holding this body weight for a period of time, and you might be moving the dial of like what that settling point is for body fat or even tissue. I mean, anecdotally, it seems like guys that have been larger for a long period of time, that tissue does seem to stick longer than you lay down tissue. And that could be a number of variables, right? It could have been, how was that added on, that muscle, was it just all gear for someone young and inexperienced, or has this been through just all training? And now you have the ability to, like, once gear's lowered, you're much better equipped to maintain it because your focus is on all the right variables and not just had been masked with gear usage. So I don't know, it's kind of convoluted within that, but I mean, big picture, nail your variables, and you won't have to worry about how your tissue was, if it's going to fall off or not. But I think to your point, Luke, that what further justifies a holding phase is whether this maintenance phase or the tissue cementing is a thing or not. I guess the argument is like, well, why not just jump into a fat loss phase straight from there? And that's when I think you see a lot of the problems would arise, because, both the push and a fat loss phase generate a high amount of training fatigue, right? So coming from a push phase, you have training volume high, but moving to a fat loss phase, you still need a good amount of training to generate a reason for muscle to stick around. But then you have less calories equipped, maybe you have less PEDs. So then you're also generating fatigue just from that too. So you're going from a state from fatigue to maybe even more fatigue, which is going to be a much more suboptimal condition. I think a quicker way to, if you could drop off tissue, very well so.
Yeah, and I think that's probably where a lot of the value is, right? Because we've all seen the preps that start, and it's like, you make these large changes and it's like 2-3 weeks and it's like shit has happened, right? And like, to use a cup as an analogy, it's like you filled this cup all the way up to the brim with the off season, and then you didn't take the time to pour any out, and now you're trying to dump the contest prep water in here. It's like, no shit, you're going to overflow, right? Like, I think that's like conceptually kind of where that thought process comes from, and getting us back to this baseline, like holding point, if you want to call it that. It has a lot of value just from like what actually happens from a response portion once we do go into that next phase.
Yeah, I think it keeps you really able to flip the switch on for prep. Right?
Yeah,
I know exactly what you're saying. Like I drop food on guys and like nothing happens. You up cardio and like it takes like 2-3 weeks for everything finally you see like, wow, okay, composition's changing. Like you should have that phase kind of planned in where you get at the best health that you can be, and then enter into a prep from there. And even then too, like if you're coming from a PED phase with from a push phase with high PED usage, and you go straight to a fat loss phase, are you just going to keep your gear high the whole time? Like, and then it's like, well, I guess you just don't really care about your health, because you're just kind of like, well, now you're in a dieting phase on prep. Like, so it's now like what, 40 weeks out of the year, you're going to be just on high PEDs. Like it's unsustainable. Like, what are you going to do in 10 years? Like you might not be here. It's unreasonable to execute it that way. And another thing, a point to it, and I know like we have some like diehard people. It's a psychological break, and
so important.
I didn't need that much, because I love that. And you're probably the same. Like,
Yeah.
I love it so much that I don't want to break from it. A break gives me anxiety.
Anxiety. Yeah.
But I think for a lot of people, that should probably be in place. And it kind of happens anyway, too. And life happens, right? There's times in life where we have vacations, we get sick, there's family planning, there's higher job demands where you might not be in an optimal period to grow or even diet. So what do you do during those times? Like, why not? That's a great time to bring food down, bring training down, hold, and then push up when you have like a really solid moment in time to be able to do so.
Yeah. And I think commonly what happens is like, you get people like you and me who don't want it, right? And then there's this like anxiety building up for like the start of prep, and they're like planning everything in order to get it ready. But I think there's also some value in that because there's like excitement heading into the prep, right? It's not like everybody knows what that end of all season phase feels like. It's like you're disgusted, you feel like you're busting out of your pants like a busted biscuit can, and it's just like not a great feeling, right? And so we get into this and we kind of refresh that like desire to prep and get people moving in the right direction. I think another thing too is like, for the people that are listening to this are gonna like have the questions around the health, like what are the things we want to pull heading into this, and just like a brief overview of like setting some of these variables up for prep. Because like for me, like I've come across people where, you know, we pull some of those labs heading into prep and we already see like they may have had previous suppression or something like that. It's like, hey, like we're probably gonna have to modulate this during prep, and just kind of like a good heads up for people going into that phase.
Are you referring to just like the PED manipulations?
Yeah.
Yeah.
Mm-hmm.
Right. Yeah. So maintaining tissue is far easier than trying to accrue new tissue. So just right there alone, like the PED load is much, much less. And you have to be considerate too, like the first couple of weeks in this phase, all the gear you're taking, usually those esters are still going to be floating around for a few
Yeah.
weeks. So don't
Yeah.
think like it's 1 week you're on 1,000 milligrams, then the next week you're on 200. It's this taper down. So the first 3 to 5 weeks, you're still very much super physiological, and you'll get a lot of health restoration just through like with the food decreases and managing fatigue. But with that being said, we even for training, we know tissue can be held on very little volume, like nearly like a third of the volume. And so the same goes for like PEDs. The amount you need to hold tissue is less. And so during this phase, why not make it the most health restorative possible and move down to a dosage that would be your own baseline? And that's going to vary depending on where you're at and what you escalated up to, your level of development. I would make sure that if health restoration needs to take place, that this is a level that does occur. And for most people, that's going to be anywhere from TRT, which 150 milligrams of testosterone a week only, to someone that's maybe very, very advanced, way beyond their, natural ability to hold that tissue. They might live on 400 to 500 milligrams of total anabolics. That might be some combination of testosterone and primobolan. I'm not saying to do that if you're not at that level yet, but I'm saying that person doing that has the realization of the risk that they're taking, and that still might not be a sustainable approach long term.
Yeah, 100%.
And some guys might not be fully restoring health markers at that. And so that's the inter-individual variations that you have to account for with your client when you're managing them. Is if you have the guy that wants to be, hold at this level and say, hey, your health markers are not going to restore at this, you should very much consider spending some duration of time at a lower dosage mark to do so. But I do think for the most part, 300, 400 milligrams, if correctly done, you could get good health markers and health within that.
100%.
As far as like the other drugs in place, like growth hormone, I'll usually bring down as well, 2 to 3 IUs as like a baseline. Insulin, I depends on what we're doing, but usually I'll keep in for the first few weeks, and then pull back as food's getting pulled back. So need is just down. And then all the other compounds are still usually in place as far as like the metformin, an ARB there. So
I think that brings us to how long this phase should be. I mean, it's contextually dependent upon someone's competitive schedule, right?
yeah, it's kind of like whatever caused the reason for you to go into the holding phase, did you check off that box at the end of it? So was it health markers that made you have to go into this? Well, did you restore health markers? So how long did that take you? This could be for what it could be. It could be there's a 3-week holding phase, or it could be up to 6 to 10 weeks. Just depends on what's the issue. Like, was it connective tissue just falling apart? Like that might take several weeks. Do you mentally feel fresh? Are you finally at a life point where you have sleep's managed, stress is managed, to where you can now enter into a phase where it's going to require a lot more of those recovery resources, like for prep or for further off season? And did you get to a point where you can now kick off back into push, like you have some body fat runway to go with, or you're at a phase of a prep where maybe you could diet for a show within 16 to 20 weeks from there?
Yep, 100%. I think also too, just like on the analysis part across this phase, you're going to see some body composition change across this holding phase, hopefully in the positive direction because of where a lot of these variables are going. Just remember, like when you're building out timelines for prep, that you're probably going to need some wiggle room on the transition from this phase into prep. So like when I do this, I'm pretty sure you do it because you kind of showed me this way of doing it. It's like mapping out the average weight loss that we would see from the person relative to their body weight and mapping that on a calendar. And then what I do is I build in wiggle room weeks, because like depending on how long that holding phase is typically, in my opinion, how well you see them respond on the transition to prep. So when we look on like duration of time, I've had some that have been as short as 5 to 6 weeks. I've got some guys who are 11, 12, because it's just restoring that, whatever that initial issue was, kind of like you pointed out. But having some like tangible goalpost is probably something that is valuable for sure.
Yeah. Like, I mean, for instance, like I like to map this whole thing out for the entire year. Like I picked my show for the fall. So I basically had a year to work with. I'm like, okay, I can have, 24-week push phase. I'll probably need some type of 8-week phase between 2 to 3 weeks of like fudge room, just of what needs to happen. And then from there, maybe it's a 20-week prep. And so you have to give yourself some weeks, but then you kind of have some structure laid out.
Yeah.
But that's off me knowing how I manage myself and previously worked. But if you never worked with the client before, that scheduled timeline might change a bit.
Yeah.
But I think once we have previous data, it's helpful because you know how that person responds, like health marker wise, like how long they can go in training before they like really start transitioning down, how long they need for a prep to really happen. Is it shorter? Is it longer? And so that can help, dial in how long the phase should be. One thing I don't think we mentioned was like any cardio or activity transitions moving from push to holding phase, or from fat loss phase to like a holding phase.
Yeah, I think hopefully, like, and this is probably my opinion, is if we're in the depths of a push phase, we're seeing this individual do cardiovascular activity that's getting heart rate elevation. Possibly you have one hit session in there because we've seen that data on the improved cardiovascular metrics with the low volume exposure of the hit training or the interval training in there. And as we transition into that holding phase, we may see the ability to, as like some of those metrics come back, transition some of that activity into steps, which for me, I'm thinking like what's coming next is prep. And I want to be able to have a runway on the cardiovascular activity side, as far as like the actual cardio sessions relative to the step count. and use like that NEAT as a tool that I can use to modulate what's happening in this bridge phase, if you want to call it, or holding phase. And then in the prep, we can have that tool a little bit more in our bag. Obviously going to be relative to where someone is at the end of a push, but that's kind of like where my head starts to go.
Yeah, I have a similar setup. Like I like to have some baseline cardio done. For a lot of people, it's just steps. If I can keep that maintained, and then moving into, so if that's already the baseline, moving into a holding phase, honestly, I won't change that. It's just really the food that comes down, and that's enough. If I had it already established, because part of the holding phase is like what seems to, when you go into a prep to get the guys moving, is having some of those, kind of be metabolically flexible and having like those, once they're able to actually get a good response out of the cardio. So you need some of those adaptations present so they can switch between those fuel sources. So you need some of that cardio present. And so if we're only been doing step count, then I would bring in some cardio to make that transition easier. And then moving into a prep, then I have the tools, like usually it's with the further food pull down before I mess too much with activity, as it's just a more accurate way of bringing down calories versus activity. And usually I still have a lot of food to work with, but I want them to be adapted to cardio to some extent, rather than trying to implement it far into a prep when it's really hard to deploy in that way. Then the opposite is kind of the flow. If you're coming out of even a mini cut or fat loss phase and some cardio was present, I rather keep step count up, and I think that helps keep guys moving with digestion, but also on a high food intake, but bringing any extra cardio that was implemented down to their baseline kind of health level.
Yeah, for sure. I think we can also think about this as like a spectrum, right? Like no cardio present, let's start bringing them into the middle where we're getting some of those cardiovascular adaptations. If we're having to use HIIT sessions to manage metrics at the end of an off season, we can probably bring it down to mostly steady state and then kind of let some of the other variables work in our favor to manage those other metrics.
Do you have a few guys that you just don't have do any cardio because they just have such a high food demand?
Yeah, I mean, I definitely do. I mean, your Mitches, like the people who are just metabolic freaks, like you can't get away with actually being progressive with it, where, the cardiovascular activity is more detrimental than it is productive, right? For managing some of the metrics.
Yeah, I have a few guys that just have, for one, they just have a lot more physical jobs or just a high activity level. Like, no way, I'm not going to have them do any direct cardio, because then the food is unsustainable. Like you get to a point where you just can't shovel in enough to outpace what they're doing expenditure wise.
Yeah,
so
sure.
It might just be, hey, just your steps, or even guys that just have like insane metabolisms or very adaptive. It's still like, just, we'll have a steps, try to keep it below a certain amount actually, and no direct cardio.
That's actually food for thought. I'm glad you brought up the adaptive portion, because that holding phase might look a little bit different for someone who's got a little bit of adaptive metabolism, because I am a little bit less willing to pull down food as much as I would for the average person in a holding phase, because I know when prep comes, like I need every bit that I can take because of how quick they're adapting to these changes, right? So I think that would probably be one little asterisk caveat, is like, what is the minimum I can do within this holding phase to get these person's metrics, or whatever the reason that stopped the push, back down?
Yeah.
Because I know how adaptive they are. And if that's going to lead into a prep, it's going to be pretty tough to get them all the way, if that's the case.
Yeah. It's not the idea of the holding phase is how little food can I get them to eat to maintain their body weight.
Yeah.
It's not, it's like, we're still trying, what do we need to do to, like you said, restore those, the markers, if they're health markers, and uphold training performance the most that's possible.
100%.
With looking in the future of what's to come too, that might have a long prep ahead.
Yeah. And I think probably like just a caveat note on the training is like, it needs to be approached with the same detailed and authority that you're approaching your sessions in a contest prep or an on season phase, right? Like you see some of those guys psychologically click off when it's this time. It's like, gears out, not time to, right? And so I think, honestly, in my opinion, this is probably the most important phase to be clicked on, right? Because it's like every little piece counts as far as like maintaining this tissue we've built. And I think that that's like a big detriment of people. And maybe the reason why some people don't make as much progress is because they do click off when they're in these phases.
Yeah, no, I completely agree. I think that's when you see guys that really fade off big time when they never had the training really in place, and kind of gear was driving a lot of that. And motivation dwindles, and it's like, why'd you really get into this? Like passion, purpose. It's like a lot of times it's like, we just love training. And so that's never changing. It's just, there's an influx of food and gear, then it's pulled back, but there's always this baseline that's present of us, grinding in the gym, of how we do. So I think that's more, not that the phase cements the gains, but how you deploy it is what's going to make you hold the gains,
Yes,
and
100%.
the other variables just have to be manipulated for the restoration reasons why we laid out. So this is the time that you really have to buckle down and implement everything like you already should be, but even more so when motivations like could be dwindling. You have to let your discipline kick in and execute.
Any other considerations for gaintaining?
Gaintaining.
This has got to be the name of the podcast.
Yeah. I think I like the name. I think that hits a lot of the points. I've seen some people bring up the idea of like, maybe this would be a time to run like a strength-based phase. I don't think so. I've seen the idea of like, hey, you're going to do a low volume phase, and why don't I have it be more like strength based? But I think then you might get into for one, it could be injurious, moving from a very high fatigue state and then trying to jump into heavy loads. Then I think training specificity wise, it gets a little far from what we're trying to do, especially the more advanced you get, the more specific that we should get in our training. And then moving into a prep, I think it makes that transition a little bit more messy. So I don't do that. I don't think there should be phases of like a more of a strength based than to kind of slingshot into hypertrophy work from there. So.
Yeah, no, 100% agree. Points to empty the cup some, right? Not just tack on some more.
Yeah. You just beat the shit out of connective tissue, then you're going to enter in a prep. So have you seen those?
Yeah, I have. I lose interest when I see it. I read the first few and it's like, it's like, I think of the opposing adaptation continuum, which is like basically the spectrum of adaptation that we can have physiologically. And then why would we take someone from the hypertrophy into the spectrum, cross it into the strength? It's like, well, I don't really see why we would move away from the specific goal. See, the only place that might have value is cross competing, and that's like none of our population.
Yeah. I mean, I guess the idea is like, well, if you can now move more weight and take that back to a higher rep range, that might drive more hypertrophy. But at least for strength gains, they're highly neural and getting more efficient with movement patterns, and it's very load specific. So if you train with heavy loads, you'll get good at lifting heavy loads. However, that doesn't mean you're increasing per fiber tension. It could be better tension dispersion, better mechanics lifting, better neural recruitment with those movements. So yes, you could be moving more weight, but that doesn't mean that you're able to expose more tension at the fiber level. And then so I don't see it having the carryover that it might have.
Agreed.
Yeah.
100%.
If you want to be a bodybuilder and you're focused on hypertrophy, keep your focus on hypertrophy.
Yeah, 100%. Yeah. I think too, it's just like the whole point of a holding phase is to make the next step into the next phase productive. Like we want to see that initial change be productive out of the gate. So why would we do things that are going to oppose that? And that's kind of where I think a lot of my logic goes into, like, what can I do for this person? Like if you're asking the question, what does my holding phase look like? What can I do for this person and for myself to make this next phase really productive? And if you can answer those questions, that's probably the most productive your how you have your holding phase be productive for your process.
I'm having other things like come to mind about adjustments, because that just might questions you might get of because you talk about pulling food down,
Yeah.
Where to pull food down from, or what to pull food down from.
Most times carbohydrate load.
Yeah. Okay. Quick answer.
Yeah.
Yeah. That's usually what we're driving up primarily.
Yeah.
Usually what's going to be causing more of the issues with food volume, and then also blood glucose and insulin. So it makes sense to just pull down on carbohydrate, leave whole protein and fats alone.
Yeah, 100%. Because you're answering the question, like, what's the metric that caused me to stop it in the first place? And if a lot of times that answer is going to be those metrics. And so that's the solution right off the bat.
I like it. I feel like that covers a lot of it.
Yeah, I do too. I think contextually dependent to your phase, like be aware of that, and like how you kind of transition the holding phase, and just take the data from what caused you to stop the push in the first place, solve that issue, and then get back to it.
Yeah, I think and then one last thing, like, because male for female, like, for females, you consider your holding phase might also be like a menstrual cycle restoration phase too.
Might be longer.
If you had someone that was coming off a fat loss phase for one, or if they've been using PEDs, a lot of these phases for females are very important for keeping menstrual function around. So that's another kind of aspect to it. But
yeah, 100%. I think that wraps it up.
All right. Well, guys, if y'all have any questions on the Gaintain, if you're listening on watching on YouTube, please leave your questions, comments below. Luke and I can try to answer those for you. But appreciate the listen, and we will talk to you next time.